Fresh, informative, from the heart of downtown. You're watching San Antonio Living on 4WOAI.
Hey, good morning, everybody. Coming up in this hour of San Antonio Living, we're going to introduce you to a robot who's actually being used to perform surgeries. We'll also introduce you to the doctor behind the robot. It's something that's very amazing. You've got to see it, and it really can change the recovery time, can change your surgery around. Very accurate stuff happening out there. We'll tell you all about Dr. Robot coming up. Welcome back to San Antonio Living. The next time you check into a hospital, have a surgery, it may be done by a robot, being assisted by a surgeon. It is the wave of the future. And joining us to tell us a little bit more about these new procedures, Dr. Vincenzo Sabella and Erin, who's one of his patients, who actually just had surgery 2 weeks ago. She's already been working a week, and she looks great and feels fine. And it's pretty amazing, this whole situation where we're able to use robots to do the things that we would do, but they're doing it more precise, aren't they?
Exactly.
So it's called the Vinci robot. The Vinci, what is his name, this robot?
The Vinci is a robotic system.
Okay.
We do Da Vinci procedures because Da Vinci is the name of the system. And it's just a very elaborate way to perform surgery with laparoscopy.
Okay.
Without abdominal incisions.
Okay.
Without any big incisions. We perform surgery to tiny 1/3 of an inch orifices in the abdomen. And we can perform big surgeries inside the patient's body. And the patient has almost no pain, very little pain. They recover fast. And the movements with the robotic system are very precise, allowing us to have very minimal blood loss. There's almost no blood loss, fast recovery.
It's amazing technology, and what you're seeing here on the screen, on the left-hand side is the robot performing the surgery. Right-hand side is the surgeon that operates the robot. So basically, you control the robot's movements through like a remote control, almost like, it looks like a gaming system, really.
Yeah, we would think a video game is very similar to this. In reality, the robot has no independent movements. The robot cannot do anything on its own. We have here Dr. Gonima, one of my partners, performing the surgery through a robotic console, and you move the robot hands with the handles in your console, and there's some pedals and all sorts of controls to perform the surgery. You can see how the handle has something called the endo wrist that allows us to move the instruments inside the patient with the same movements as our human wrist would do.
Wow, it's amazing technology. How long have we had this here in San Antonio?
Well, we had it in San Antonio since 2005. St. Luke's Baptist Hospital was the first hospital to acquire a Da Vinci robotic system. And we started doing surgery from the very beginning, and we've done over 700 now.
Fresh, informative, from the heart of downtown. You're watching San Antonio Living on 4WOAI.